So there is this patient who is telling me that doctor, I am not able to feel the sense of pain and temperature even if hot water is being poured on me. Let's look at this interesting case. This is your friend Dr. Devesh Bhatt and this is part 11 of episode 11 on Syringomyelia. Let's get this started. So whenever the pressure of cerebrospinal fluid starts rising inside the central canal, we have a condition which is known as syringomyelia. So let's look at the cross section of the spinal cord over here. We have this small little hole in the center which is nothing but your central canal, which is having CSF inside it. And what will happen if this CSF, the pressure of the CSF starts increasing, the central canal will start dilating, compressing adjacent structures, forming something like that. And what is there inside the spinal cord surrounding the gray matter? We have the white matter, the tracts of the spinal cord. And one of the very first tracts to be affected in this condition is your lateral spinothalamic tract, which is responsible for carrying your sensations like pain and temperature. So let's look at those causes which are firstly responsible for causing the increase of pressure of cerebrospinal fluid level inside the central canal. One of the very first example is your syrinx formation. What is syrinx? Syrinx is nothing but a fluid filled cyst. So in the center, you can appreciate we have this CSF running in the central canal, and there is this narrowing over both the sides. You can appreciate, and this is forming a cyst-like structure, which is nothing but syrinx. And if we look the same image in a radiographical image, so this is a T2 weighted MRI image. This is a T2 weighted MRI image, and you can appreciate this hyper intense cyst looking structure, which is nothing but your syrinx, okay, which is causing increase in pressure of the CSF below, hence causing syringomyelia. So what are the other conditions? Even if you have condition like Chiari malformation type 1, in which the cerebellar herniation occurs, hence causing increase in pressure of the CSF in the central canal, causing syringomyelia. Even if you have vertebral pathologies like scoliosis, it can also result in increase in pressure of the CSF, causing syringomyelia. So whenever a patient is presenting to you with syringomyelia, the patient firstly will complain that doctor, I have this loss of sensation of pain and temperature in this cape-like distribution around the arms, shoulders, and the back. And what is cape-like distribution? If you can see our dear Dr. Strange, who was a neurosurgeon, he is wearing this red color cape. So the patient will have loss of sensation of pain and temperature over this area as one of the very first signs of syringomyelia. Whenever you will see a patient of syringomyelia, you will observe that the patient is always having some frequent burns in the hands because the sensation of pain and the sensation of temperature is lost. So the patient won't know if he's touching a hot surface, if something is hurting the hand of the patient. So the patient will always come with frequent burning of the hands in a case of syringomyelia. And I hope you like this video. Stay tuned for more. This is your friend Dr. Devesh Bhatt signing off. Shukran, alvida, ma salama, take care and do whatever you want, my lovely friends.